After the third miscarriage, it was just, I think I had my mindset that, you know, it might not ever happen.
I didn't go to any baby showers. I didn't want to talk to my friends that had kids.
There's hopelessness in it. It's heart-wrenching at times.
The hardest part about infertility is watching your wife kind of go through the process of being infertile and being powerless over that.
I had to come to terms with it may not ever happen. I hoped that it would, but I think I prepared myself for the worst.
It's heartbreaking for women over 35. If they don't have a partner, the clock is ticking, and what are we going to do?
It was kind of a shock. I didn't realize that because in my family, there's never been any issues with any of the males.
Infertility really affects the entire family. It even breaks the hearts of grandparents who long for that grandchild.
Infertility is a medical disorder that cuts across ethnicity, race, religion, and even socioeconomic status. So we have women and men from all backgrounds who have struggled with this disorder. And what is very positive is that also cuts across all of these aspects is the fact that we can help those couples to become pregnant. We can help those couples to achieve their dream of having children. Sometimes family, friends will say, well, if you would just relax, it would happen. But sometimes there really are medical problems that are preventing pregnancy, and it's very important for couples to understand that those medical problems can be identified and corrected.
Patients think that there's sort of a cookie cutter way that we do things, and it's not. It's based on age, it's based on family history, it's based on their pain issues, it's based on their history of surgery, their history of problems in the past with gynecologic problems.
After the history, physical, and blood work, then there are several other tests that need to be performed. Very important among those tests is the semen analysis.
Once the basic infertility evaluation has been done and we can determine the cause of infertility, many cases women just wouldn't be able to get pregnant without surgery. Either their tubes are blocked and sperm and eggs can't get together, or once sperm and eggs get together and they can't, and an embryo is formed, there may be difficulties with implantation and risks for miscarriage if these surgeries hadn't been done. I think one of the advantages of surgery presently is that over the past 10 years, we've learned to do many procedures that used to require large incisions. We're able to do them with small, minimally invasive procedures like a laparoscopy or a hysteroscopy. The hysteroscopy is especially designed to look inside the uterus, the cavity of the uterus, and it's, again, a minimally invasive surgical procedure. You do require anesthesia to have it, but it's a very quick anesthesia and a quick recovery period as well. There's no incisions on the body. We just go through the natural opening of the uterus. Laparoscopy, that's a diagnostic procedure on the one hand. It's also an operative treatment on the other hand. Sometimes when we really don't have the answers after a basic evaluation as to what the cause of someone's infertility is, we'll have to proceed to a more invasive step. That would be a diagnostic laparoscopy. Then we would have the ability to look not only at the reproductive organs, but at the other organs associated with the reproductive organs in the pelvis.
Potential problem, she may have a blocked tube on one of the x-ray studies. She had a blocked tube.
We were infertile in that we couldn't hold a pregnancy. We could get pregnant and it just wouldn't stick. We'd miscarry 3 times.
Struggling with her through all of it. It's probably what I would say that the most difficult part of it is the fact that you're powerless and really can't fix it.
And so with every miscarriage, you know, every bit of hope that you had kind of disappears. And
the miscarriages were very, very hard because in many instances she had miscarried, but yet she still felt pregnant.
Well, we were referred to the clinic after our 3rd miscarriage, and it's something that I really didn't want to do. I didn't want to go to a fertility clinic. I was okay with going to a fertility clinic, but I didn't want to do all the testing and the shots and You know, I think I was in fear of what they might tell me. I think I was scared that they would tell me that I would never be able to have kids. So we started the whole journey of being tested to figure out why this was happening. After we found out it was a structural issue with my uterus, they could fix it surgically, and Dr. Yeko performed the surgery. And it was a fairly simple surgery. I really had it set in my head that maybe it would never happen. And the fact that it did, I mean, it was really, we're just so thankful, and it was really, really a dream that we wanted, and to be there and to have her, it's just a miracle.
The day I held the baby was pretty awesome. For me and for my wife. And it was kind of one of those things where we felt whole, where we'd survived the journey, that we'd reached our destination.
In vitro fertilization is what IVF means, and what it is taking the sperm and the eggs outside the body and combining them literally in glass, which is what in vitro really means.
You ready to have your procedure done?
Yeah.
You have a lot of good eggs for us?
The scenarios with IVF are that there's different kind of infertility factors. So the typical type is where a couple needs to have their eggs stimulated and retrieved and then fertilized with the husband's sperm, and the resulting embryos then put back into the wife's uterus.
This is an ovary, and those are follicles. Each one of those dark circles have fluid, and in that fluid there's an egg.
There are different scenarios where the husband may be sterile, and that's where we actually also take the sperm and inject it into the egg. It's a procedure that's called intracytoplasmic sperm injection. But if that can't happen sometimes, then we do use donor sperm to fertilize the egg. The other scenario that we talked about is that when a woman doesn't have her own quality eggs, then we use a donor to go through IVF, get her eggs out, and then fertilize it with her partner's sperm, and then the resulting embryos are put back into the woman's uterus at that point.
Okay, we're going to check and see if we have eggs in that fluid.
Okay, I got 3 eggs from the first cube.
Hey guys, I have great news. We have 10 great eggs. Good. So you have a fabulous chance of getting pregnant. Yeah, okay?
All right. We started out at a regular OB doctor, and I seemed to check out fine, but he had some issues. He had a varicocele.
After I had this surgery, I thought for sure that, a few months would go by and we find out magically that she was pregnant. So we were very hopeful that that corrected the issue.
So we tried to get pregnant again, and it still wasn't working. It was not fun. All my girlfriends would call, and they were getting pregnant, and every phone call would be, oh, so-and-so's pregnant, oh, I'm pregnant again, I'm having my second or third baby, and there's baby showers to go to, and I didn't want to go to any of them. I did one IVF, which was unsuccessful. I did my second IVF with Dr. Tarantino, which produced my daughter, and I did a third IVF, which was unsuccessful, and now we're on our 4th IVF.
When I first saw my baby, it was a surreal moment of all of a sudden, finally you are a father, you're somebody's dad.
I can't imagine, what did we do before we had her? We have no idea, we can't remember. She's the best, we have a great time with her.
It's very important to us as a practice to be able to help the community, reach out to the community and educate. One of the ways that we are doing that now is that we have established the New Beginnings Fertility Conference, which is a wonderful free seminar for couples that are given one weekend each year. The most important thing in this journey and struggle to overcome infertility is to gather information, because certainly information is power.